And welcome, Dr. Christina Hung Huber. Thank you so much for being here today.
Well, thank you for inviting me. I'm looking forward to our conversation.
Absolutely, it's my pleasure. Let's just jump right into it. My first question is always um, how did you decide to become a psychologist? How did you decide to become a mental health professional? And once you did make that decision, what was your journey to the population that you specialize in serving?
hmm So I had a somewhat traditional yet a slightly kind of meandering experience. So early on, and I don't know how much of this is because I'm an only child, but I've always been a very curious person. And I think for many only children, your imagination is something that keeps you sort of entertained and occupied, since there aren't, you don't have siblings and other people to amuse yourself. So I've always been a very curious person. I've always been drawn to the field of psychology. Um, Interestingly enough, I think I don't want to speak generally, but I think in the East Asian community, and I guess I should speak more specifically for the Korean community, mental health and psychology is still not a very understood area. So I think I really loved psychology, but it didn't seem like a hard enough science, you know, for my family, for my parents, but also I think for kind of the community as a whole. So in college, I ended up sort of gravitating more towards neuroscience. And I think neuroscience really did a nice job of sort of melding my interest in psychology as well as it being a little bit more of a approved hard science. So that's how I ended up doing some psychophysiology research. And after college, sort of the automatic trajectory that I think people in sort of my area went with either medical school or getting a PhD. And medical school is not my cup of tea, so I ended up going into a clinical psychology PhD program. And at my first doctoral program, I was continuing doing psychophysiology research, which I think not so long after my first year, I realized that wasn't really necessarily what was fulfilling for me. However, I think when you're in a program and you're going down the trajectory you had sort of planned for yourself for so long, it was hard to leave. But I think over time I started to realize when I was at my clinical practice and rotations, just how much I enjoyed working with patients and having the in-person interaction as compared to sort of staring at the computer screen looking at brainwaves. So for folks who are interested in that, I applaud you. But for me, I really find myself uh, like yearning for, for in-person people interaction versus sort of the data and the analysis and the research I was doing. So about halfway through my program, I got my master's. I ended up leaving the program, and I took some time off to really reassess, what am I really interested in? What do I see myself doing for the next 30 or 40 years? So I took some time off. I was doing some therapy and also teaching a couple of adjunct undergraduate psychology courses. And I found myself just really feeling engaged and inspired with sort of the clinical, like the therapy sessions, as well as teaching. So I think to me that confirmed, I want to go back and get my doctorate, but really focusing in on becoming a licensed or trained psychologist. So I started a second doctoral program that was specifically oriented to, training clinicians. So I graduated from a doctor's psychology program. And I mean, my area that I work with older adolescents, adults, and couples, ranging, in presenting concerns anywhere from anxiety, depression, cultural challenges, interpersonal difficulties, trauma. I think those were sort of the populations that I found myself really um, kind of gravitating towards. I mean, I think personally, we all have had experiences where we've had, dealt with experiences of anxiety and depression. And I know for me, being a woman of color in this country, I've certainly had some challenges in terms of my identity, being bicultural, being a first generation Korean American. And I think there are lots of, when we think about trauma, there's also a lot of cultural and relational trauma. So I think for me, that led to me being really interested in that population. And not surprisingly, where I am right now, I'm in the DC metro area. I certainly work with a number of white clients, but many of my clientele happen to be, BIPOC, folks, largely Asian American, because I think it is really reassuring and comforting to have a therapist who may not exactly understand, but who can identify and at least have somewhat of an idea of what your unique experience is like. So I would say, that's sort of how I got to where I am right now. So as a psychologist, not as a researcher, as I had anticipated in college.
That's a really interesting journey. Um, Something that you said towards the beginning, I thought was really interesting. I was just wondering, you said that psychology wasn't a sort of a hard enough science for your family in terms of what they thought you would go into or what they wanted you to study. Was
Hmm.
that explicitly relayed to you, or was that something that was just understood as an expectation? Does that does that make sense?
Yes, yes, it absolutely does. I would say both, but I mean it was certainly explicitly stated, but I think also as I got older,
Okay.
I think my sort of experiences with, besides just my parents, but my extended family, I think I was sort of pegged as the smart one, as the academic. So I think there was a lot of pressure externally from my family, but as well as internal pressure for, within myself of needing to sort of meet these expectations. So I always get a chuckle out of this when I talk to some of my Asian, but I think also BIPOC clients, in that, there are these acceptable positions or careers that one can be in. So a medical doctor, a lawyer, an engineer, like a business person, I think those are the acceptable positions. So I think when I was floating the idea of a psychologist, I think my parents were okay with the idea that it was still some form of a doctor, but it wasn't a medical doctor. So it's interesting to me as I think about, my decision to go into neuroscience. Had I not had that sort of explicit and implicit pressure, would I have just gone straight into, maybe a clinician oriented program rather than going the neuroscience route and kind of having a meandering sort of journey to it? But I think over time they've understood, just I think my desire and why I've gravitated towards it. I also think one of the reasons why I ended up gravitating into this area is because, at least for the Asian population or Asian American community, mental health is still not really well understood. It's still very stigmatized. I think there has been an increase in understanding and acceptance, but there still are just so few clinicians out there, and there's so many barriers that it get in the way for um, Asian clients really finding culturally responsive therapies. So oftentimes people might start off, but they might end up finishing or not even doing a number of sessions because they either feel like the therapist doesn't understand them, or there's just all these barriers, logistical barriers in terms of insurance, or finding a therapist who might at least identify in certain ways. So for me, I was very passionate about being in an area that I think is not really well understood by my community, and trying to find ways to increase access resources, because I think the Asian community as a whole is probably one of the, uh, I think, primary groups that really underutilizes mental health resources. And yet I think our group is has a pretty high rate of mental health challenges and difficulties, and not to mention what I had said earlier about the cultural and relational trauma. Not that, and it's interesting we're having this conversation today, especially with everything that's recently happened this past week as well as this past year, with the increase in anti-Asian hate crimes and violence. So I think for me, I'm so honored and really grateful that I ended up where I am today, being able to work with and provide services. And it's been, really a great honor to be able to be where I am, providing services for folks who I think are really, really needing it and wanting it, and just really unsure of how to access services and help.
Right. Absolutely. So there's so many barriers. The stigma of mental illness and taking care of mental health needs, but also the lack of Asian therapists that are out there. And can you talk a little bit about, because that was one of my next questions. I was wondering, you talked a little bit about many of your clients being BIPOC, and so
Hmm.
do you find that when patients do find you, that they have, because for example, when patients find me or call me or see me online, they say, I have been looking for you. Like, I
Hmm.
could not find anyone else who
Hmm.
looks like me, or anyone who I think would understand or in some ways identify. Do you find that a great deal, that you have that as well?
Hmm. I have a very interesting experience because right now I'm in a group practice, and I would say all of my colleagues, I think except for one, they all identify as white. So, as in most spaces, I think having grown up, except for I think in my childhood where I grew up in New York City, where it was very diverse, from middle school up, into college, and even in my different grad programs, I've navigated white spaces predominantly most of my life. And even in this first, postgraduate job, this practice is also very white light, and I think is representative of most kind of psychology spaces. So I have a very interesting experience because I get some of my referrals from my practice, and of course the referrals that I get really are quite random. So I might have white clients, I might have clients of color, but I also have another medium where the practice allows me to, sort of get my own referrals. So whether it's through inclusivetherapist.com, psychologytoday.com, asianmentalhealthcollective.com, like all of these sources allow clients to find me. And it's just a very interesting experience of certain clients who are explicitly looking for someone who might identify or who might understand their experiences in a way that maybe perhaps a white therapist may not. So I think what you just said, I mean, I would completely echo that. There is something really, I think, powerful when someone feels like they are understood, that they're seen, that they're heard. And I think one of the things that has been really meaningful to me is that, I'll have some clients tell me that they had worked with a different therapist who wasn't Asian. And there are certain cultural practices that I think, from an outsider's perspective, can sound very dismissive, very negative, very problematic. But yet I understand because I was very much ingrained in that culture. So I think having somebody who can understand and not pathologize or jump to certain conclusions, I think that is a very empowering, a very liberating experience to not have to worry so much about how you're filtering yourself. But I think the other thing that I hear from a lot of BIPOC clients, especially Asian clients, that tell me is, I don't have to I don't have to always explain things to you. It was so exhausting. It was so tiring that I had to explain these things, or they had so many questions and I had to teach them. And I think that's one of the challenges, if I can speak in a more general way. I think for a lot of people of color is this burden of having to teach, whether it's their colleagues, teach their friends, even teach their therapists. That's a big burden to be shouldering. So and that does not take away or dismiss, or I'm not critical of white therapists, but there is something really, I think, comforting for certain groups, certain communities, to know, especially if it's their first time going to therapy, to know, wow, okay, I might not be judged, or I might be able to speak a little bit more frankly, or I don't have to explain everything, and they might get it. So, to me, I feel like that is just such a powerful gift that I think we as therapists of color can give to our clients.
Absolutely. Yeah, I think that's spot on. And I think that it is so taxing to constantly be expected to educate others
Hmm.
on experiences, or, you know, certain aspects of whatever BIPOC culture. It's just we
Mhm.
are constantly asked to educate other people and explain ourselves and explain so many things, and so that does get to be really just exhausting.
Mhm. Mhm.
Yeah.
Definitely.
Do you ever have the opposite where someone thinks that you are unable to understand because of who you are, or you're unable to relate to them because of who you are?
I've had that happen to me, and I don't know if I'm fortunate or not, but I haven't had those experiences where it's related to my race. So, for example, I think like early
Hmm.
on in my training, I was working with someone who was in their 60s and she was a grandmother. And at that point, and I mean, as you're seeing me, I look very young for my age. And I think that's something that I got very early on in training. It's something that I still sometimes get is that I look very young for my age. But early on in my training in my 20s, I remember I was working with an older woman, and she was saying, "You don't get it because you don't have children or you're not married." So I've gotten comments like that where people question or wonder if I can understand or really empathize because I may not have had certain life experiences. But in terms of race, that's not necessarily something I've gotten. Perhaps it's something that people might be thinking about, but they haven't explicitly voiced to me. So I think in some ways that might be, I think an advantage that I think being a BIPOC therapist, I think it provides us this um, almost like an automatic, I think, assumption for clients that we will have the capacity to understand if that may not necessarily be true. Whereas I think if it's a white therapist trying to work with a BIPOC client, they don't have that sort of kind of advantage. I don't know if advantage is the right word to use, but I've never had and I don't know if it's fear of naming, our racial dynamic, but I've never had a white client tell me, "Oh, I don't think you can understand because you're not white or because you're a racial minority." So it's a tricky thing. It's an interesting thing to kind of think about how my racial identity, especially the intersectionality of me being an Asian woman, a first generation Asian woman, how that in some ways can be an advantage and sometimes can be a disadvantage. But as of yet, I haven't had any sort of explicit instances where, because of my race, someone has explicitly told me you don't understand. It's been more in other segments, maybe because of my rate, my age, or because of uh, not having grandchildren. So it'll be interesting. I imagine it might happen at some point, but I haven't had that experience yet.
Okay. That's interesting. Okay. And so for you, can you talk a little bit about um, what is the most stressful thing about your job?
So, and I feel like maybe a lot of psychologists, a lot of therapists can probably understand. I think the challenge of, really, and I know this is sort of the focal point of this podcast, talking about self care. And I think for me, especially being a therapist of color in a big city that really lacks uh, therapists of color, especially I think Asian identifying therapists. For me, a very challenging thing is trying to find ways, some kind of fluid, flexible boundaries in terms of not feeling guilty. Because I think because I'm so passionate and for me, it's so important for me to provide services and be there and be an ally and be a support for the BIPOC community. I think at times I've found myself maybe overexerting myself, maybe not having as rigid of boundaries, offering more times, maybe taking on a lot more than I should be doing. And I mean, that certainly ebbs and flows, but I know like summer of 2020 with everything going on with like the Black Lives Matter movement and understanding for me specifically and sort of sitting with and processing and understanding the anti-Black sentiment in the Korean population, really kind of doing a lot of self-reflective work and wanting to, be there, support, be an ally to the Black community, I found myself really feeling pushed to, you know, to offer more slots, offer more hours, take on more clients, especially clients of color, because I felt the responsibility to be an ally and to provide those services because, as I said, there are so few BIPOC therapists in this area. So I think that's probably one of the most challenging things about my job is knowing how much I can take on. And that I think changes depending on the context, depending on the situation and what's going on around me. I think in this past however many months since the start of the coronavirus, as I said earlier, there has been a tremendous increase in anti-Asian hate crime violence. I think in one of the statistics they were saying in most major cities in the US, there has been a 150% increase. And I think even in New York City, where I was born and raised, 833% increase, which is, I mean, it's just mind blowing. And it's not that anti-Asian sentiment is new. It has been here since the 1800s with the Page Act, the Chinese Exclusion Act, the Japanese internment camps. There are so many instances, but there's something about this recent, I think, year where it has felt different. And I guess if I can sort of share a little bit, my parents recently I was talking to them on the phone, and they were asking me, do you have, do you carry around mace? Do you have some form of protection? And keep in mind, I grew up in New York City, and for middle school and high school, I grew up in the suburbs outside of New York City, but I went to college, went to grad school. I've always been sort of independent, and they've never asked if I carry on protection. And I think for me, that was one of the most salient things where I realized something feels different, that my parents, who have never asked me in my 30 plus years of if I'm carrying on protection, they're asking me that question. And yeah, it's been really, really challenging. And especially this past week, but I think in the past year or so, it has been really hard, especially working with Asian clients, because I have to be there to help hold and support them while they're suffering, while they're in pain, while I'm also in pain too. And I think the other challenging aspect of my job is that being in a very predominantly white space, that I think the experience of being Asian in this country is at times being invisible, not having a voice, being silenced, or being, seen as sort of the perpetual foreigner, as we say. I have that experience in so many places. I think even like at my practice, for example, where, my colleagues, they're all great psychologists, but, the majority of them are white, and they don't understand what it's like to really be holding the pain while also working with and treating patients who are also going through this racial trauma. So I think that's been especially challenging, is knowing how to balance, your own self-care and also processing and sitting with and finding ways to ways to cope with the pain that you're holding for yourself while you're also doing that for your patients.
Absolutely. Yeah, that's incredibly a difficult thing to do. Can you talk a little bit about how it is that you um, either have been able to do that, or some of the ways that, because you talked about a lot of things that I think are just so important, including the fact that, well, first, although right now there's a great deal of attention being paid to anti-Asian violence and sentiment, this is not new. This has been around for forever. And it's really interesting that you talked about being born and raised in New York City, where, now I think you said there was like an 833%
Mm-hmm.
increase in anti-Asian violence. And what I think is really interesting about New York, so I lived in New York for a total of about 10 years. I live in Florida now, but what really struck me about New York is it's incredibly diverse, very true, but there's no less hate than anywhere else. It's just that people pretty much were ignoring people that they
Mm-hmm.
didn't understand or didn't know or who looked different from them. Because if
Mm-hmm.
you remember, New York is incredibly segregated in
Mm-hmm.
terms of who lives where. But, that the anti Asian sentiment has been there forever. It's just now people are paying attention to it. So for you as a therapist, I just wonder how, knowing that, you talked a little bit ago about having that guilt, trying to take on too much, feeling guilty that you can't help everybody all the time and that there has to be something for yourself. How do you navigate your way through the fact that you're, helping clients all day, every day, taking on that pain from them while you're dealing with your own pain,
Mm-hmm.
and then you can't really disconnect from what's going on because you're hearing, for the past year, this just incredible escalation in these violent attacks, and you're seeing it everywhere. So how are you able to at some point take care of your own mental health and in your
Mm-hmm.
own well-being enough so that you can keep returning to
Mm-hmm.
helping the clients and, helping them navigate their way through
Mm-hmm.
their own pain and their own,
Mm-hmm.
experiences?
You hit on so many points, so let me see if I can sort of comprehensively touch on all of these great, insights that you bring up. So, growing up in New York City, I was born and raised, but of course, I've experienced all different forms of overt, covert, microaggressions. Like, where are you from? Why don't you have an accent? You speak great English for, an Asian. I've been called chink. I mean, all these things. And, I think growing up as a child in New York City, in Queens, which has been sort of the hotspot of the coronavirus, and also there have just been so many violent attacks in Queens, which is heartbreaking for me because that was my childhood hometown. To your point of people kind of like it's being segregated, but people kind of ignoring, like for the most part, I think growing up, I'm sure my parents and grandparents sort of sheltered me as much as possible. But I think there's the thing that feels so different is that people would, say these slurs or, they'd be walking by and stare at you or something. But there was at least some, even if it's a false sense of safety, some sense of safety of like, they'll say these awful things, but I'll go home knowing that I'll be okay still physically. I think one of the things that our community is grieving, and this is something I talked about with my client actually, I think yesterday, very recently, one of the things that we're grieving is that this, even if it's a false sense of safety, a security over your physical body is now gone. That's been taken away. Um, and sort of related to that, I think one of the ways I have engaged in self care has actually been through processing some of these sessions, some of these experiences with my clients. So I'm not saying that all of my BIPOC clients or that all of my Asian clients have wanted to talk about this. And especially for all the Asian clients that I saw this week, especially, I think for my Asian, female clients, I mentioned it to create some space and opportunity to talk about it. And if they didn't want to, I totally respected them. But there were a few who really, I think, needed it. And if I'm going to be completely honest, I think I needed it too. And it was just such a moving and powerful experience to be able to, I think mutually feel really heard, feel really held. And I think one of the things that I shared with my client, which I think I was sharing this for her as well as for myself, of reminding us that we're not alone. We have power, we have a voice, we're not invisible. And I mean, the things that had happened in Atlanta is beyond atrocious, and I have many words that I won't say in this podcast because it's not appropriate for me to say these words, but I think hopefully if anything that comes out of this is that people start to not just give it attention, but realize that Asian Americans in this country, we're sick and tired of this happening, and we are going to now hopefully feel empowered and have a voice and start speaking up. And I think this model minority fallacy that has been put upon us, I think many of us in the community as well as outside of the community, I think is realizing that this model minority fallacy was built by white supremacy. It pits us against other racial minorities, and it only serves to uphold white supremacy. It does not, it has not and will never help our community or other racial minority communities. So if anything, I'd like to hope and pray and believe that through this awful, awful experience, that at least we might feel more empowered and feel like we have a voice and that we can collectively come together and rally around and be supported by our allies and do something about it. But going back to this notion of, self-care, I think for me, like, especially this past week, I sort of allowed myself to indulge in being able to collectively process and collectively, I think, heal with my clients, and being very free and frank and vulnerable about my feelings, being in the position that I am, how heartbreaking this is, how challenging this is, and talking a little bit about really understanding what it's like to be, I think, especially for a lot of my Asian sort of female clients who are in professional roles, they're also in very white spaces, and how hard that can feel to feel invisible when not all organizations and companies are talking about this, when this isn't, I think that experience of going to your work or your job and this not being at the top of the agenda of the meeting, not being talked about by your workplace, that it reinforces this the idea that we are invisible. So I think for myself and for my clients, I was really emphatically stating that, you are not alone, you're not invisible, you have a voice. And I think for me, that has been really helpful in processing, in part healing. And then for me, I think I was also so moved when I had, non-Asian, non-BIPOC clients actually check in on me. And I was so, I don't know, quite startled to have them ask me, because I think I was feeling so invisible, so detached. And I think just simply having somebody ask me kind of made me realize I am important. I do have a voice, that I do have an impact on people. And sometimes it's really helpful to hear that, hear that from my clients. Not that I, expect that from them. But yeah, I think in some ways my self-care has been through some of these sessions or some of these experiences, interactions with my patients. But also beyond that, I think for me, I've had to be very cognizant about setting boundaries. So, after certain work hours, whether it's professional or personal related, like I'm on video calls all day, I'm burnt out. I do not want to stare at a video call. So if someone wants to talk with me, which I'm very appreciative of, I will be very mindful of, is this something that I can do tonight, or is this something that would be better served on the weekend? Is it fair for them if I'm not fully present? So I think sort of setting boundaries for myself and not feeling like I need to fulfill all these obligations, which I think is a little bit part of my upbringing and my cultural experiences of feeling very obligated to have to follow through on things. I think another thing for me is, making sure I'm consistently checking in on myself of like, what am I needing in this moment? And if that means at the end of the day, I want to veg out and watch some Netflix, I allow myself. It's very easy to have self-deprecating thoughts about, oh, you need to exercise, you need to eat better, but I'm carrying around a lot of pain for myself and for my patients. And if that means I want to indulge in a cupcake and watch and veg out on the couch, I've been allowing myself. And I think self-compassion is such an integral part of our self-care, routine. And I think also that another thing for me that I've been trying to be very mindful of is limiting my social media exposure. So I'm not very active on social media, except for I think with regard to like racial justice, which is something I'm very passionate about. I think those are the only sort of posts that I make on my social media. But I have to be very mindful to not be on it too often, because I think for me, when I'm seeing certain individuals who are very detached and I guess in many ways privileged to not have to really notice or understand what's happening, it can induce quite a lot of rage in me, to feel a lot of envy, a lot of frustration that there are certain people who um, are able to disengage, who have the capacity to disengage. And I think I have that envious sort of rage that comes up sometimes. Um, and I have to be very cognizant that I don't then transfer that onto someone else or onto a certain experience. So I think those are some of the things I've had to be very, very mindful of over this past year, needing to make sure that I'm taking care of myself so it doesn't end up coming out and negatively impacting, my personal relationships as well as my relationships with my clients.
Absolutely. Those are, again, so many really excellent points. One thing that I want to go back to for a second, you said something very interesting that um, I'm just wondering. You talked about going onto social media and having the experience of seeing people who had the privilege of disengaging and had the privilege of just sort of, sitting by because this is not their life and it is not going to impact them one way or the other. Um, and I had the same experience where the past year has really opened my eyes to people that I thought, um, you know, respected and cared about me as a human being. But then when you look at the bigger picture, some of their behaviors in terms of saying things like, who cares? It doesn't matter. It's all going to be the same thing. Or,
Mm-hmm.
I was okay with, people standing up for not being murdered in the streets like dogs for no reason. But when Target got damaged, that's when I decided that this was
Mm-hmm.
terrible and, these people are wrong. Um, were there any people for you that were closer to you or people that you considered sort of your friends that when things really sort of um, started escalating and they started showing their true colors, that it kind of gave you pause and made you see that what you thought they were or how you felt they, cared about you or supported you was completely different from what the actual reality of it was?
Mm-hmm. So these, I think what I'm going to say may not be liked or appreciated by certain people, but I think in terms of like my social media and who I follow, it's very biased, of course. So I'm either going to be following people who are also just as involved or um, are just as passionate about racial justice, or maybe people who I don't know might not have much say. But I certainly don't follow any people who are explicitly blatantly racist. And if so, I unfollow for my own mental health, for my own needs. I unfollow. But unfortunately, and I think this is something that I've witnessed last year and this year, is that people who are, unintentionally, or what we want to call, whether you want to call them subtly or covertly racist, people who are unintentionally trying to be, but nevertheless are still engaging in racist sort of behaviors, or having sort of racially based, beliefs. Those people are something harder to notice, harder to pick out. And I think one of the things I struggled with, in the summer of 2020 is just this, bombardment of performative, allyship of people hashtagging, putting up one or two photos and thinking, okay, I'm a good person now. And for me, I think that was so infuriating, I think for me, it was even worse than people who just didn't have a say at all, because that was the trendy thing to put up hashtag, you know, Black Lives Matter. You put up one post and then you're relieved of your guilt that now you're considered one of the good ones. So for me, that was really, really hard. I think sometimes even the more subtle, covert forms to me can be I think, much more frustrating than in some ways people who are blatantly racist, because at least I know who you are, I know what to expect. It certainly doesn't justify their behaviors, but at least it's very obvious of who you are. And I think with everything that has been going on, um, more so recently with the anti-Asian, violence and the anti-Asian sentiment, I was very appreciative of my friends, past colleagues who reached out to me, who were Black, white, Asian. But for me, for some reason, I think those that I expected to reach out to me and didn't, I think those voices or lack of was almost deafening. It was so loud to me. And I think it was, such an utter disappointment, right? I think of expecting certain people to just simply reach out. And I know there's a lot of anxiety and fear from people of like not knowing what to say or not knowing what to post or how to behave. Like at the end of the day, I'm a human being. I would really just appreciate, I think, some acknowledgement, even if you don't know. It doesn't have to be something poetic, but simply just saying I'm thinking of you. And I can't, um, understate how appreciative I have been for those who have reached out. And I think that they know well, they're well aware that there's nothing they can maybe do for me in that moment, but simply just stating that I'm here for you, I support you, you're seen. Like that is so utterly moving. And I think for those that I was expecting to do that and didn't, that was also, I think, very, very heartbreaking. So to your question, I haven't necessarily seen people post things that were very antithetical to my beliefs, probably because I'm biased and I've filtered, my different social media profiles to remove certain people that are very, I think, to my opinion, toxic. But I think for me that those have been the ways where I've been very, very disappointed and let down. And then, certainly then makes you wonder, this lack of acknowledgement, is that reflective of the person? Is that reflective of their relationship or beliefs about me? It's hard because it then, as I said, I think earlier, it reinforces this perception that I am invisible. It reinforces, I think, the experience of it being Asian American in this country, that either people, are colorblind and don't think of us as being a minority, which is, goes back to this whole model minority fallacy, or that I'm simply just not important enough to them. And I think, one of the basic tenets of therapy is really feeling seen and understood and held. I think we all need that. I think as human beings, we all want that. We all appreciate that. And I think when those who you expect, those who you respect and love and care for don't reciprocate that, it's profoundly disappointing.
Absolutely. Yep. Um, yeah, that's yeah, very, very powerful, very impactful, and yeah, absolutely. Do you find that there is just always an expectation? Because you spoke a little bit a couple of times about that um, sort of invisibility at work, as well as just in general in terms of the Asian experience of living in America. Do you find that there's also, in addition to the idea of the dangerous model minority myth, that there's kind of an expectation both from outside and from within to just sort of take whatever comes your way and not
Mm-hmm.
not speak out about it, not complain about it, not fight back about it, anything like that? Are there any of those things for you that you've experienced?
Absolutely. I think, understandably, I think there's a generational divide. So what I mean by that is I think for, my parents' generation or the generation before that, as immigrants, they had a vastly different experience. I mean, they probably experienced a lot more explicit, racism and discrimination than perhaps people in my generation. And I think because they came here and they were simply just trying to survive, I think the attention to their well-being, the attention to the impact of these, racist acts and discrimination and prejudice, I don't think that they had as much like cognitive and emotional like capacity to really sit with that because they were just simply trying to survive. So in some ways, I'm not justifying it, but I could understand why I think for my parents' generation or for the older generation, there's always been, I think, this sort of explicit as well as implicit pressure of just, just kind of go on with it, just, ignore it or, just kind of move on with it. You need to make it here in this country. So you're going to deal with it and just kind of buck up. And, not to be dismissive of my culture, but I think that's been the experience of just mental health too, is you can sort of will your way through it. It's not you can figure it out on your own. You don't need to go to a therapist or an outside resource to get help. And I think that's been sort of the experience of keep your head down and keep working at it, because that's what has been promised, I think, through this model minority fallacy, is that if you, keep your head down, you work hard, you don't, we've given up our voice, you will be rewarded with this American dream, which hasn't been the case. So I think for, as I said, with the older generation, I think they have bought into this belief, understandably, because they didn't know that this would be the experience that we are having. Now, I think as, first, second, third generation Asian Americans, as we've, had more access to resources, more education, I think, having a little bit more representation, whether it's in government or even in media, I think it has empowered us to start to really question, this model minority fallacy, start to question by us sacrificing or giving up our voices, has that really benefited us? And it has absolutely not. It has harmed us. If anything, it has, as I said, pitted us against other racial minorities. So I think that, and I can't speak for other families or other people, but I think for myself, like I see that even within my generation and within my family, I think many of us believe the same things, but I don't think not everyone is as vocal. And I think maybe part of this is because I am in mental health. I think I've always been sort of pegged as a sassy one too. So I'm certainly going to be the one who has a loud voice, which is why I was so appreciative to have this opportunity to have a platform to talk about this, to have other people, even if it's a podcast, to have other people know that there are, members in the community talking about it. So I've been really, really, pleased to see that there are, Asian Americans or API members in government, in Hollywood. And I mean, most recently, was it earlier in this week, Steven Yeun, he, I think in 93 years, is the first first Asian to receive the Best Actor Oscar nomination. And yet it's being overshadowed by, the monstrosity of what happened on Wednesday. And I think that has been in some ways sort of reflective of the Asian experience of never feeling like we can fully revel in our excellence, revel in our, all of our achievements, because at any moment that can be taken away, which I mean, I think this week has been a clear example. Not feeling like you have that constancy to feel that sense of stability. And that is a frightening experience. That's a dehumanizing experience to not be able to feel like you can celebrate your community, because at any point, that can be taken away, that safety. And I was recently talking to a good friend of mine who also went to my graduate program, and uh, she'll be graduating soon, but she's a rising, Black psychologist, and she was telling me the same experience that I think, and I'm simply just repeating what she's saying, but it's a very similar experience, I think, of for the Black community in terms of not feeling like you can really revel in that the excellence of your culture, because at any moment that can be taken away or something else will overshadow it. So I think for me, I've been appreciative of having all these different people reach out to me, but I think especially, those who identify as Asian, or those, my friends and colleagues, who are Black. I think for some reason for me, those comments and messages have really felt the most impactful, because I think they are the ones who really know how it feels. And as I said, I don't dismiss or I don't undervalue, my white colleagues and friends reaching out, but there is something else, I think, that speaks to, I think, unfortunately, really understanding, I think, just the experiences of if your community hasn't gone through it, not really fully understanding just the fear, the anger, the rage, the betrayal, the disappointment. I mean, I can go on and on.
Right. Absolutely. And I think there is something very valuable in that, the fact that, our different minority groups do have very similar experiences. And I think that, part of what's been put in place for us, that whole model minority myth, the whole system or structure of white supremacy does pit us against one another.
Mm-hmm.
And we are having these experiences that are very similar, but in our, different communities, but we're also pitted against one another to think that, oh, well, that group, we're not going to talk to that group because they're going to
Mm-hmm.
bring us down because they're all insert whatever adjective here. And I think that you're absolutely right. That idea that, like, that's very dangerous and it's harming, it's harmful, it's harming all of us. Um, and it's interesting that you talked a little bit about the idea of your parents saying, you go along to get along. And if you work hard enough, you'll be able to be rewarded. If you just, go along, you'll be fine. Interestingly enough, that's exactly what I was told by my parents. Just the idea that, if you work very hard, you do really well in school, you get, a lot of education or higher education. My parents always told me that once you get to a certain level, that's they said that stuff doesn't matter, but they were talking about the idea of race or the idea
Mm-hmm.
of looking different from everyone else. They had this idea that, education was the way to pull you out, and if you just worked hard enough and don't make a fuss and don't be a problem, then you'd be perfectly fine. But I think that is exactly what perpetuates this
Mm-hmm.
idea that we, stay silent. We don't say anything despite the, unspeakable violence that is perpetrated on us. We
Mm-hmm.
still just stay quiet and we just keep going and we try to move forward a little bit more. But I think that that's not, it has never worked and
Mm-hmm.
it still is not working. So I think, I love your idea of, just speaking out and being vocal and saying, we're not gonna sit around and be everybody's punching bag. It's
Mm-hmm.
completely unacceptable and, it's inhumane and not okay. So I
Mm-hmm.
think that's really important. But I think especially just the idea of we have such similar experiences. I think that there's definitely strength in working together
Mm-hmm.
as communities as opposed to just sort of, there's, it's really interesting that you said, and I really appreciate that are freely talking about the fact that within the Korean communities, there's a lot of like anti-blackness.
Mm-hmm.
And I think that in the, Black community, there's a lot of anti-Asian sentiment. And I think that until we all start to address the sort of anti other group sentiment that's within our communities
Mm-hmm.
and talk about why that's there and realize that that's probably there, because the dominant caste put it there and made it so that
Mhm.
we had to fight one another in order to try to just not be at the top. I think that's a really important part to not let go or not let slip away. Just understanding,
Mhm.
okay, why do we have these ideas? Like, why are we not like teaming up with all of these other groups to say, like, this isn't okay, we're not going to continue doing it? Like, I just don't,
Mhm.
I think it's a really important thing to talk about and to keep moving towards.
Absolutely. And when we think about how can we, take some action, or what can we do within our own systems, because sometimes it's so easy to start to feel helpless or powerless, because sometimes this feels so overwhelming and so beyond us. And I think something that I've been telling myself is, great, I can educate myself, I can post about it, I can donate money, which is all these things I've been doing, but also within my own family. Case in point with my parents, over the summer, we had a long discussion about the anti-Black sentiment in the Korean community. And I think something that I was very cognizant of when having this discussion is to be curiously compassionate. I think it's the term that I like to use with my clients, of not trying to criticize them, but to really understand how, I think when both groups are in such pain, are suffering, sometimes it gets improperly displaced. And I think I can't help but harping on this idea over and over again of, why are we pitted? Because who's benefiting from it? It's white supremacy. So I don't know how much my dad took away from it. I think he did, understand quite a bit, and I think it I'd like to believe it stuck with him. But even simply just having conversations, really uncomfortable and stressful conversations with our family, I think that's somewhere where we can start. And I know, of course, I'm a little bit more equipped than maybe a lot of people, because, part of our work, we're used to having these tough and uncomfortable conversations. But, I think if we try to just ignore or dismiss or sort of protect people because you don't want to necessarily rock the boat, that's such a disservice. And that in itself is how, white supremacy wins, how white supremacy benefits by using our fears, using that discomfort to keep things status quo. So I think for me, it's been really challenging, but also I think I'd like to think in many ways really empowering for me to be able to reach out to my friends and colleagues and family who range who range all across the different racial identities, to be able to really understand, not just to educate, but for each other, for all of us to really understand, what are our biases, what can we do to really sort of sit with and reflect on how problematic, or how um, yeah, how problematic, or how we ourselves might be perpetuating some of these um, misbeliefs or stereotypes, whatever it might be. So, I mean, I know that I've been doing a lot of the work. I don't know what other people are doing, but at least that's all I can do on my end, is, post about it, educate myself, really do some self-reflection, understand the biases within my family, within my culture, donate money. I mean, I think those have been the ways for me to find a voice, to feel empowered. And also, I think the other part is really sitting with and processing the pain, processing just this like grief that I think many communities are experiencing. I think sometimes that can be really hard, is doing all the action oriented items can be really distracting from the emotional work, which I think is just as important, if not more important. So I think that's something I've been able to do with some of my clients, which, I've been really honored and privileged to be able to be a resource, to be a support for them, for me to be able to be a compassionate voice while they do that really, really challenging work.
Absolutely, yeah. It is, and I think that's a good point. It is work. It's a lot of work, and I think we all have to be willing to do it.
Mhm.
Um, I think, you know, just getting more information, being willing to look at our own behaviors and views and understanding like things that we say or things like I think there are a lot of like phrases or sayings or colloquialisms that are steeped in some sort of racism or bias, and just
Mhm.
understanding like that these things aren't okay and understanding why we have these assumptions. I know you talked a little bit about the work that you've been doing, and I applaud that. I think that for me, I've also, you know, been doing more just there's so many things. I feel like there are just so many things I don't know just about um, why things are the way
Mhm.
that they are, like systemically, and
Mhm.
how we got to where we are. I think there's so much just about like American history in terms of the country's treatment of different groups that I just
Mhm.
never knew, that I
Mhm.
still don't know enough about. And so as I'm
Mhm.
reading more and more, it's one of those things that I have to also balance with my own kind of mental health, because you can't unring a bell. And after you kind of, get all this information and you learn all this stuff and you realize what
Mhm.
actually has gone on and what continues to go on,
Mhm.
I don't know about you, and maybe you can talk a little bit about it, but for me, it's been quite impactful. Just sort of the more information and the more that I'm seeing what actually happened versus
Mhm.
what we were led to believe happened, like being educated in the US school system and what we learned
Mhm.
about US history and what actually happened versus reading the actual, historical documents
Mhm.
or the books that are dedicated to certain things. Like, did you find that to sort of be impactful and kind of eye-opening once you, started to read more about it and kind of learn about these things?
Mhm. Yeah, so something I like to share with just folks in general is that, I think there's sometimes a lot of guilt or shame of, oh, I haven't been doing this, I haven't been informed enough or doing this work. And something I will share is that, and I feel a little bit of guilt and shame too when I say this, is I haven't always been steeped in this work. Um, I mean, growing up, especially once I moved to, Long Island, which is a pretty white suburb of New York City. I mean, one of the, I think, experiences that I think many minority adolescents have is wanting to conform, to the norm. So like at times I remember like so desperately wanting to fit in and be white, have blonde or brown hair, have blue or green eyes, and not look like, not have my skin color, not, you know, have certain Asian features. And I mean, that in itself, I think, is all of our individual journeys of getting to a point where we can accept and understand the nuances of being a minority in this country, of being bicultural. And I mean, I think it wasn't until more so towards my the start of my second doctoral program when I really started to kind of understand and see how ingrained and embedded racism was, especially the more covert and subtle forms, and how it seeped even in higher education, to what you were saying earlier about your parents saying that once you reach a certain level, that's not a problem, you'll be protected. I think that's a perception that many older, I think, folks have, because that's sort of the dream, right? Is that you slug through all this and eventually you'll reach the pinnacle and you'll be protected, which is just clearly not the case. And I think for me, I it hasn't been that long, maybe since 2015 when I started my second program. That's when I was willing to see that all of these systems in place were there, because I bought into this idea based on my being a child of an immigrant, that these systems are there to help us out. But I think slowly, as I was starting to sort of see things chip away, that I no longer had these rose colored glasses, I started to see that I myself, by just being silent, by buying into this, I was helping to perpetuate this. So I think one of the things that I like to tell people is to not, get dragged down by the guilt and shame. and being able to sort of honor the fact that at least now you're aware, you're starting to notice, make change. And I think, I mean, one of the things that we've talked about, I think even in media, is that so much of our curriculum has been whitewashed. I think for many of us, and this isn't, I feel almost guilty and ashamed to say this too, like Juneteenth, I don't think that that was something that I knew up until, a couple years ago, which I just saying that, I just feel cringy just saying that, but it's been such a whitewashed curriculum. And it's been, I'd like to think it's been informative, but also empowering to be able to start to really get, um, to learn about history from a different lens, from a non-white supremacy lens, to really know how, all of our groups have been, harmed, have been cast aside, have been, treated as second best, and how, and what have been the systems that have allowed us to buy into, or not allowed us, but has led to us buying into and just sort of continuing maintaining the system of white supremacy. So I think that's probably one of the things that I think a lot of people like to start with, because it feels more concrete. It feels a little bit, I think oftentimes intellectualizing can be easier than sort of sitting with emotions. So I think sometimes for many folks, it's easy to start to just educate yourself, simply learning facts. I mean, as I was just thinking about our conversation today, and just thinking about just anti-Asian sentiment, and just knowing that this is something that it was happening even in the 1800s, and thinking about like the model minority fallacy, and how this might be kind of just interesting if people are listening to this, to my conversation about sort of just why why the model minority fallacy is so problematic. But I think this is a scholar from Harvard, but Claire Jean Kim, she writes about racial triangulation, and how that has been sort of another mechanism that has kind of pitted, the Black community and the Asian community against one another. And it's sort of on, I think the two aspects are, inferiority versus superiority, and being sort of a foreigner versus being an insider. And it sort of shows this like triangulation of how, this system has led, for many other minority communities, seeing Asians being kind of seen as better, which is certainly not the case. But I think there are these like assumptions and beliefs that are being projected that communities buy into, which then I think then leads to a lot of these, anti-Black or anti-Asian or whatever, like sentiments towards each other. So I still have a lot of work to do, but I think it has been really helpful to feel informed, to be able to, when I'm having these conversations, to feel like I have information, objective information to provide to people, as well as I think the other piece of doing that emotional work, of really sitting with and reflecting on, I think especially kind of the pain and suffering of my community. How have we, caused pain and harm to other communities, and vice versa? And how can we find ways to be able to heal collectively, to come together, to support one another, so that this system that benefits white supremacy doesn't keep happening? And I think one of the really cynical things I was telling my partner this summer is that what happens in the U.S. in this country is that it's one minority group is targeted, and that attention isn't taken away until it's then pivoted onto another minority group. So it's like a hot potato of, of negative attention and targeting of groups. And this will continue to cycle. This loop is going to continue to cycle until we disrupt the cycle. And I don't think that will happen until more of us are informed, more of us are willing to do the work. And I hope that's the case. I hope, if anything, with all of the attention, with the Black Lives Matter movement, and more recently with the anti-Asian hate crimes, that if anything, I hope that will lead to more people being willing to do the work, be willing to inform themselves, to reach out, provide support, and to really lift and support one another rather than just kind of keeping our heads, low and sort of just moving on. Because if not, I mean, if that's the case, then this will be a continuous cycle for many, many, many more years.
Absolutely. I think that's spot on. I think we only get through this if we get through it together. And I think
Mm-hmm.
that's the best way through. And, um, you know, arming ourselves with the knowledge and reaching out and being willing to do the work and admitting, as you just did, like, I still have a lot of work to do. I think we all still have a lot of
Mm-hmm.
work to do, no matter where we are on that journey of, realizing, pardon me, where we are and where we need to go. I think we
Mm-hmm.
all still have a great deal of work to do. So I think that's very important and incredibly insightful. Yeah. So I thank you so much for this, for being here. I have to tell you, I really enjoyed this conversation. I think that these are conversations that really need to be had all the time, every day. It's definitely, they're very emotional. They're, taxing, I think, just to talk about
Mm-hmm.
all these things and just be processing all this stuff that's going on. And I think you and I could talk for another like 3 hours just about all this stuff, because I think we're both very passionate about it, and there
Mm-hmm.
is so much and so many different layers of what's going
Mm-hmm.
on and the variables that are in play in terms of
Mm-hmm.
where we've found ourselves, in this current situation. But I just am so appreciative of your being willing to sit down and talk with me, and for giving your time and your perspective, which it's been just incredibly insightful,
Mm-hmm.
impactful. So thank you very much.
Well, I want to reciprocate the thanks and the gratitude. I very much appreciate having this platform to talk to you, but also hopefully this will provide, I don't know, a medium for certain people, whether it's potential, future clients or just people who want to, learn a little bit more about the experience of being Asian, especially being an Asian mental health professional in this country. But uh, I think, if anything, these conversations have to be had. And granted, I know it's a little bit different because you and I are both trained psychologists, but you don't have to have a degree in order to have these conversations. That you don't have to know exactly, say the perfect thing or say the exact right thing. And I think, if I'm going to be a little bit honest, I had a little bit of anxiety thinking about what did I want to say, because there's so much on my mind and I wanted to be very thoughtful about, the comments that I was going to be making, and kind of thinking about who will be listening to this conversation, and how will this impact the people that hear it. And I think what I came to realize is that that's too much cognitive effort for me to be so worried. And I think once I allowed myself to just sort of freely have this conversation with you, which I very much enjoyed, and I think you're right that we can probably talk for 3-4 more hours on this topic. I think in many ways it was very freeing, very liberating, just to be able to talk and speak my mind. And I think to hopefully show other Asians in this country that we are not alone, we are not invisible, that we have a voice and we certainly have power, and that we do have allies that are here to support us. And I think that's sort of a mantra that I've been telling myself, I've been telling some of my clients, and I hopefully is something that can be shared with other people who hear this podcast.
Absolutely. Yes. Thank you. Do you want to talk a little bit about your practice, any projects that you have coming up, or also tell people how they can get in touch with you?
Absolutely. So I think as a form of self-care, I don't have any projects that I'll do a guest lecture. I think most recently, a couple weeks ago, I did a guest lecture at American University for a class. I believe it was like stress coping emotion class. But I think for my own sake, or my own sort of mental health self-care, I've limited, the sort of obligations that I've put on to myself besides this podcast, which was very important for me to do. So I don't have any current projects. I think right now I'm just focusing on my patients, focusing on myself, and hoping that as the spring and summer, as we come into the spring and summer, that there will be an alleviation of the pandemic, and hopefully we'll be able to see one another again, which I think is so important. But in terms of how people can reach me, so I'm currently a full-time psychologist at the Arlington DC Behavior Therapy Institute, which is located in Arlington, Virginia, which is just a couple of metro stops right outside of DC. But I am licensed in Virginia, and I have telehealth capacities to see folks in DC. So they can either look me up on the Arlington DC Behavior Therapy Institute website, which is arlingtonbehaviortherapy.com, or they can email me if they're interested. It's Dr. Hong Huber, so DrHongHuber at arlingtonbti.com. And, I hope to have maybe in the future some projects, but for now, it's really kind of taking care of myself and taking care of my clients and my family, I think right now during these tragic times.
Absolutely. That's plenty to have on your plate. Absolutely. So thank you again for being here. I don't know if you've had a chance to listen to any previous episodes of the podcast, but something that I like to do at the very end is called the finisher. And it's just a final question that has nothing to do with mental health or self-care or anything like that. Because, I like to ask people random questions, and also I like to, end the podcast on a little bit of a lighter note, because a lot of times we get into, very important, very like emotionally heavy things. So I want to, talk about something that's randomly about something else. So for you, can you tell me the top 3 destinations on your travel bucket list?
So prior to the pandemic, my partner and I we had planned to take a graduation trip. So I graduated in May of 2020. So we were going to do a graduation trip, and it was going to be. I haven't been back to South Korea since I was 13, which is 2 decades or so. So we were going to go to South Korea to visit my family and just sort of see, because so much has changed since I was a child, and he had never been to South Korea. So we were going to see South Korea, and then we were going to potentially check out a couple of European cities that I haven't been to before, and then maybe check out a tropical place like Bora Bora. So I guess top 3 destination, I'd love to return to South Korea and see just how much it's changed, how sort of westernized it's become. I guess in terms of a European city, I haven't been to Paris, so I'd love to see Paris. And then maybe third tropical destination like Bora Bora, or French Polynesia, or one of those tropical places. I think those would be the top 3 places. If and when, or I don't want to say if, when things open up, I'd like to be able to travel to those locations.
Fantastic. That sounds like those sound like cool destinations, and I love that idea for the graduation trip that you were taking. I hope that you and your partner get a chance to go soon.
I hope
Absolutely.
so too.
So once again, yeah. Once again, Dr. Christina Hong Huber, thank you so much for being here. It has been an absolute pleasure.
My pleasure as well. I hope to speak to you soon.